What's going on, everyone? Happy Monday to everyone. Hopefully everyone is doing well, staying safe, healthy. If you had to take a COVID test, hopefully you have tested negative. If you did test positive, I hope you have a full and speedy recovery with no long COVID issues. It is time now for the Monday edition of the Pandemic Update for Monday, August 26th, 2024. If you're new to my channel, this is where I do the daily pandemic update. No, not always from this location, from here on Interstate 395 in Connecticut, but yes, I do a daily pandemic update where I update on what's going on with the COVID pandemic and other viruses. Today, we're taking a pandemic update out on the road as I am traveling to visit some relatives up north. If you're new to my channel, give this video a thumbs up, hit that subscribe button down below, share this video with anyone you know, hit that notification bell, and leave your comments down below. Of course, in our Out in the Wild updates, which we haven't done one of these in quite some time, I do bring notes with me, things that I have found in relation to the pandemic and other viruses, and we are going to talk about two different viruses today. First off, we have to talk about the Democratic National Convention, which was just last week. The Democratic National Convention, there's quite a few tweets going on X. Have there been more today? I don't know. I haven't been paying attention today, but yesterday there was a whole flooding of people tweeting on X that they are testing positive for COVID after attending the Democratic National Convention in Chicago. And wastewater has started to slow down in Chicago. It's not dropping anymore. Before it was going up, then it slowed off, started dropping. Now it's, starting to level off once again. They just had a huge number of people there for that event, and plus schools are going back as well. The news is starting to pick up on this, so we'll have to see what happens. We'll have to see if any notable figures test positive, or if they do, will they actually announce their case. Last night, B&O gave their weekly update on what's going on with COVID and the new numbers, and I do have that here. I did copy and paste that onto my notes here. So the B&O weekly U.S. COVID update is as follows. New cases in the United States, 174,455 estimated cases. Mind you, that's just the number of people that have actually reported a test. Far number of people do not report a test. They use the at-home, and wastewater would suggest the number is much higher. The average has actually gone up again, 167,635 cases, and that is up by 8,237. In the hospital, mind you, not all hospitals report. I'm hearing several people telling me that in November they're going to be required to report again. I hope that really becomes true, because we need to know what the real number of hospitalizations are. But here's the number that we know about. That is at 5,434. That's up by 178. In the ICU, 617. That's up by 50. So those numbers are still rising. They may rise for another week or two. They're going to drop relatively soon. A number that actually did drop last week, which is a little bit surprising, but still over 1,000, is the number of new deaths, which is at 1,075. Yeah, we had another 1,075 deaths in the United States in the summertime. COVID has no season. COVID can be all year round. Anytime a new variant pops up, if the characteristics of it are a little bit different or something's different, it can drive cases and all the other numbers to go up once again. The average number of deaths is now up to 906. That's up by 134. I think we're going to be flirting at or around 1,000 deaths for a few more weeks. We may see a little bit of a drop during the holiday week of Labor Day because, there may ultimately be a lag. But for the most part, I think we have a few more weeks of at or around 1,000 before I hope we get a drop, but we'll have to see. All right, some more statistics. The most notable increases this week were reported in Colorado, where they saw a 76% increase, and Texas saw a 64% increase. Tennessee saw a 30%, Kentucky 27%, Wisconsin up 22%, Georgia up 21%. Ohio was still up 14%. Yeah, we saw that increase last week in Ohio. And California actually dropped 10%. That's some good news. And I can make a personal note. Though be it's a Monday, I'm up here in Route 395 in Connecticut. I never went through Southwest Connecticut so fast before. I don't care what day of the week it is. There's usually traffic. There was a little bit before 395. That's because of road construction. It looked a lot less busier than normal. I'm wondering how bad the COVID wave is here. I mean, wastewater does indicate of high levels, but you have to wonder, if COVID didn't exist, would there have been more volume on the roadway? I don't know. Mind you, it's a Monday in late August. A lot of the summer vacations are coming to an end. Of course, next Monday being Labor Day weekend, that is definitely going to be a lot busier. And yeah, there's still high levels of COVID going around, so your chances of catching COVID over Labor Day weekend, and we'll talk about more about that throughout the week, your chances of catching COVID over Labor Day weekend, they are still elevated just because the levels are still high. Only 33% of hospitals in the U.S. submitted COVID data this week, down from 33.6% last week and 91% in May. This means actual case numbers and hospitalizations are substantially higher than reported. This is the second week in a row with more than 1,000 new COVID deaths in the U.S. It's also the 232nd week in a row with 400 plus deaths, or 1.2 million deaths in total so far this year. Someone was asking about this yesterday. We'll get to that. Here's the yearly statistics so far. So far this year, nearly 4.8 million COVID cases have been reported in the U.S. Now, we do not know how many of those went on to develop long COVID. There'll be studies that come out down the line, but there's no actual count. The CDC, the local states, they're not counting the total number of people that go on to deal with long COVID. And it also says this has caused at least 340,153 hospitalizations. And that's with limited data. So the real number is much higher, maybe 400,000 or 500,000. Yeah, that's ridiculous. We're still in 2024. Partial data, it says. And 37,301 deaths. And who knows? Some things aren't even being marked as COVID. Like, for example, someone has COVID, then dies of a heart attack. Is it being marked down? Or if someone had COVID, they recovered and have post-stroke, blood clots, heart attack, something else down the line, that's not being counted as well. No, we don't have a long COVID death count. Maybe there's some estimates out there, but we really don't have estimates on that. All right, there's a state just north of me. I'm going to be traveling through that state. My final destination is northwest of Portland, Maine. And I have to travel through this next state, which will be Massachusetts. Well, I haven't talked about it much. I need to talk about this because people have been leaving comments about it, and it really is happening. And there's a virus called Triple E. I'm not going to try and pronounce the virus right now, but sorry for that. But there's a virus called Triple E, which is being spread by mosquitoes. It's a problematic virus. It can cause rashes. It can cause a whole array of symptoms. I'm reading from what I'm starting to learn about this virus is most cases are not severe, but there can go on to be some severe cases. Maybe you can get hospitalized. And currently 10 communities in Massachusetts are under high or critical risk of the virus, according to the state's Department of Public Health. And this morning before I left, I did see a map that showed southern Massachusetts is actually doing really bad. Just up the road where this road, 395, becomes I-290, that is a community that is currently at elevated or high levels for this virus. So that is not good. And some communities are doing curfews as, you know, the mosquitoes, they do tend to come out more early in the morning and then again at nighttime in the evening. So please be mindful. I know there's thunderstorms up the road. It's one of the reasons why we're recording here and not in New Hampshire. And you know what rain means. Mosquitoes, they love water. So if there's any standing water, avoid those areas. And please stay safe from that. In Philadelphia today, or yesterday I should say, good news. 781 EMS calls. We'll have to see what happens. It was first day of school for a lot of schools in southeast Pennsylvania. We'll have to see if that causes any increase in cases. And of course, Labor Day weekend, next weekend, levels are already high. It's been a really long ongoing wave this summer. So therefore, I don't expect to see cases go higher, but I think what's going to happen is we're going to see like a leveling where if they were dropping, they're going to flatten for a week or two. Then they will resume dropping. And we got all these other events as well. But again, it's already been a long summer. So there may be some sense of immunity which of course that immunity is going to wane off as we head into the wintertime, and probably those who don't get infected with this summer wave are at a higher chance of getting infected with the winter wave, especially those who decide not to get a booster. All right, real quick about this rest area here. I believe it's near mile marker 32. We actually went inside, did an AirNet reading. No, this was not the reading. My windows are closed at the moment, and the air conditioner's turned off. But we actually went inside, used the restroom. Hardly anybody inside. You can see behind me, there are a few people around, but not many. The AirNet reading, which I just posted to X a few moments ago, was in the 500s. That's fantastic. I purposely avoided the I-95 rest areas because, well, 95 is a much busier road, and they tend to be more crowded, and I wanted to avoid that altogether. Walgreens did not get to look at that today. I don't even think it came in yet. Last week it didn't come until Tuesday, so we'll have to see what happens with that. We'll be doing, I don't know if it's going to be a out in the wild update tomorrow or a data-filled update from my laptop, which I did bring with me. We'll have to see how things go. Maybe I'll just take down notes, or will I do an update tomorrow? I don't know. There will probably be an update definitely on Friday. If not tomorrow, definitely on Wednesday. There'll be updates along the way, but we may miss a day or two. Overall, levels around the United States for COVID at this time are leveling off, and they're starting to drop. You still have some random areas that are high, and like I said, things will flatten off and stop rising, or stop dropping during the Labor Day weekend, but then I think they will resume dropping once again within a week or two later. And of course, there will still be some back to school outbreaks that will occur. We'll probably get reports of some schools that have to close for COVID. And then, of course, a month from now, flu will start up, which, if you live in Mississippi, your flu levels are already at the early stages of rising. So you want to pay close attention to that. And once again, this virus up in Massachusetts, this mosquito-borne virus, it is coming near the end of the warm season where we're going to start transition in the fall. But mosquitoes will still be a problem well into September. So please take extra precaution. If you must go outside at the time of day where they would be most prevalent, wear some bug spray on you. Wear long sleeves. That would be a really good idea because, there's a whole bunch of different viruses. We just saw Dr. Fauci at his home. Where does he live? Down in the Mid-Atlantic. Dr. Fauci at his home had West Nile virus. That can also be prevalent as well anywhere at this time. And of course, if you're going into the great outdoors, watch out for ticks as well. There's a lot of different tick-borne illnesses that are problems as well. Alrighty, folks, that does it for the Monday edition of the Pandemic Update. I'm going to get back out on the road. Next Pandemic Update will come from the great state of Maine. If you enjoyed this update, give it a thumbs up, subscribe down below, hit that notification bell, share this video with anyone you know, and leave your comments down below. I will see you all again next time. Until I see you again next time, stay safe, everyone, and have a fantastic Monday afternoon. And remember, keep masking. I got tons of masks with me. I intend to continue using them. We wore one in this rest area right here. No one even stared at me. Well, it was just me and 2 workers in there at the time. All right, have a fantastic Monday. See you all again next time. Thanks for watching.